Thank you for nice introduction, and I also appreciate to the Professor Seung-Yeok Koo and the program committee. It's a great honor to share my research data with you at this symposium. Today, I will talk about some of the molecular mechanism and a solution for endometriosis-related infertility. So our lab is interested in the endometriosis. As you know, endometriosis is a disorder in which tissue that normally line the uterus grow outside. Its major symptoms are infertility and chronic pelvic pain, and the prevalence is around 10% of reproductive women, but it's nearly understudied disease compared to the other disease. And what we are interested in is it's associated with the implantation failure. It's the endometriosis is related to progesterone resistance and estrogen dominance. But we do not know how the endometriotic region outside the uterus compromise the fertility, because around 50% of patients has infertility issue, but another 50%, around 50% endometriosis patient doesn't have any issue for the fertility. So today I will share our research data, what we presented in this year about the role of GRAP2 in endometrial uterine function. So first, GRAP2 is the adapter protein. It's in ligand and bind to the tyrosine kinase, and it's activated signaling pathway, MAP kinase pathway. One of the famous receptor is EGFR. We also looked out EGFR in the uterus, and then its knockout mouse showed severe subfertility due to the implantation failure, especially desvisualization defect. So first, what we did was we checked the expression profile of the GRB2 in the healthy control woman, and as well as infertile woman without endometriosis. As you can see, it's the GRAP2 expression is nearly strongly expressed in the stroma cell and epithelial cell during the whole of menstrual cycle. However, the expression of GRB2 is significantly reduced in the infertile woman, especially infertile woman with the endometriosis. GRB2 expression level is significantly reduced in the both compartment. And then we ask, does endometriosis cause a reduction in the GRB2 expression, or is it just a passenger and indirect effect? So what we use is we use the preclinical animal model. So in the rodent models are well developed and used. What we use is based on the retrograde menstruation, we inject to the endometrial tissue to the peritoneum, and then it's developed the endometriosis. It's recapitulated endometriosis. But as you know, mouse is very small, and it's difficult to detect the endometriotic region just without any reporter system. So what we did is we combined with the two reporter system. One is the luciferase, another one is the GFP. So if it's combined with the Cre-LAXP system, progesterone receptor mouse model, it's all of uterine cell, including the endometrium, express luciferase and GFP. So using the bioluminescence, we can see the uterus in the animal model, and using the 3D reconstruction, you can make the uterine structure. And also, if you open the mouse, we can see all of the uterus cells are GFP positive. What that means is if we induce the endometriosis using this mouse model, in the naive animal model and just the ectopic region, we can detect in the live animal, so we can see the progression of endometriosis. So it's possible the non-invasive imaging. And also the advantage of GFP reporter is we can see the live visualization of the ectopic lesion. As you know, GFP is a very sensitive and fast reporter, and we can detect the very small size of ectopic lesion, and also it's possible for the quantitative analysis. And if you apply the image-guided surgery, we can see the effect of surgical removal the ectopic lesion. Because in the clinic, I think the recurrence rate of the endometriosis is more than 50% within 5 years. And using this animal model, we can study about the endometriosis infertility study, because other rodent model we use the ovariectomy or the chronic estrogen treatment that is destroy the mouse reproductive system. It's impossible to study about endometriosis-related infertility. And another thing is endometriosis is a hormone-dependent disease, estrogen dominant. So when we inject the estrogen, a number of ectopic lesions is a significant increase compared to the vehicle. If we give the progesterone, it's significantly reduced. It recapitulates the symptom of the pathophysiology of endometriosis in human. And another important thing is when we study about infertility during the endometriosis progress, what we observed was the 1 month after endometriosis induction, we do not see any fertility issue, but after 3 months, we see the implantation failure rate is significantly increase in the mouse with the endometriosis. And we also observe the desvisualization defect using the artificial desvisualization model in the mouse with endometriosis. And using this animal model, we check the GRB2 expression level before endometriosis induction and after endometriosis induction. As you see in the sham mouse, we can see strong GRB2 expression in the epithelial cell and stroma cell. But after we induce endometriosis, even the 1 month after endometriosis induction, we can see the significant reduction of GRB2. And then it's more severe effect 3 months. So it may involve the endometriosis-associated infertility. So to make the mimic condition, we can apply the uterine-specific GRB2 knockout mouse. Before we check the knockout study, we first check the expression profile of GRB2 during early pregnancy. As you can see, the GRB2 expression is started very strong in the uterine epithelial cell at the GD 3.5 and the GD 0.5 to the 2.5, and at the GD 3.5, this stage is just a pre-implantation stage. GRB2 expression is significantly increased. And then at the implantation stage, GRB2 expression is increasing in the primary decidual region, and after that, it's also keep the strong expression. So if we reduce this GRB2 expression like the endometriosis, we study what happened. So using the PR3 model, we lock out the PR positive cell in the mouse. That means all of endometrial cell do not have the GRB2. We check the infertility, and then we examine the uterine development, ovulation, embryo implantation, and desvisualization. First, we validate a knockout of GRB2 in our mouse model. As you can see, the GRB2 protein expression is almost gone by the Western blot and the immunohistochemistry. And then the most important thing is this mutant mouse show the infertility phenotype. Control mouse show the normal litter size and pop number, but knockout mouse doesn't have any litter or pops. And then the uterine function is regulated by the ovary. So we examine the ovarian function in this mutant mouse. So first thing is steroid hormone production, estrogen level and progesterone levels are not different between the control and mutant mice. And the histological analysis also show the normal ovarian histology in the mutant mouse. After that, we know the GLB2 mutant mouse show the normal ovarian function. We check that suggests infertility phenotype is from the uterus. So we check the early pregnancy effect of GLB2 knockout during early pregnancy using the ultrasound. You can see the 5.5 is just post-implantation, and we checked through the GD 9.5. We can detect the implantation site, number of sites, and size of embryo. Using the 3D reconstruction, we can exactly know how many implantation sites are there, and also the monitor the embryo growth. In the control mouse show the nice normal number of the embryo and embryo growth, but GLB2 knockout mouse we do not see any implantation site. So that suggests the GLB2 knockout mouse exhibit early pregnancy loss. And then more detailed analysis at the GD 3.5 in the using the Chicago blue dye injection. You can see the control mouse show the very nice implantation at the GD 4.5, and the embryo is attached to the luminal epithelium, and the lumen is disclosed. But the GLB2 knockout mouse show the abnormal histological phenotype. So embryo cannot attach to the luminal epithelium and just floating, or some of embryo near the implant luminal epithelium, but it does not attach and cannot invade to the stroma. So, and also the marker of early residual marker PTGS2 COX2 expression is a strong expression in the control mouse, but knockout mouse doesn't show the COX2 expression. So another important molecules are the POX01 and PGR at the implantation site. In the physiological condition, PGR expression is disappear in the luminal epithelium at the implantation site, but and then the POX01 is strongly expressed in the nucleus of the luminal epithelium. But in the mutant mouse, we can see the abnormal expression of POX01 and PGR. So the knockout mutant mouse show the implantation failure due to the critical, the abnormal expression pattern of the critical protein. Because the mutant mouse show the implantation failure, we cannot study about the effect of the GLB2 knockout in the deserialization. We applied artificial deserialization. What is the artificial deserialization? We injected the mimic hormone and treatment during the early pregnancy, and then we give the trauma like the embryo attachment only one uterine horn. You can, and then you can see the nice deserialization response in the control mouse. Control horn show normal histology of uterus, but it's stimulated horn in the control mouse show the nice the deserialization process. But in the mutant mouse, we do not see any deserialization response, and then also do not see the characteristic the deserial cell, and as well as we do not see the expression of deserial marker gene expression in the mutant mouse. So that's demonstrate mutant mouse have the failure of the deserial response. And then from the mouse phenotype, we also want to know it's not limited to the mouse. We use the human primary endometrial stroma cell. We can induce the in vitro desvisualization process. And then and we are combined with the SRI knockout study and see the effect. First, we check the expression of GRB2 in the human primary stroma cell from the woman, control woman, and woman with endometriosis. You can see the GRB2 expression is significantly reduced in the human endometrial stroma cell from woman with endometriosis. It's same to the histological analysis. And then we induce the SRI knockout and in vitro desvisualization. In the control stroma cell, we can see the nice induction of the desvisual marker, IGF-BP1 and PRL. But in the GRB2 knockdown cell, we get both expression of the IGF-BP1 and PGR expression is significant down. So that's mean the GRB2 attenuation reduced the desvisualization in the human primary endometrial stroma cell too. And then we want to know the more detailed molecular mechanism of the GRB2 loss in the infertility. So we move to the earlier time point, GD 3.5, mean the pre-implantation stage. So in the mouse and the human, I think it's the same thing. At the pre-implantation stages, epithelial cell proliferation should be shut down, and the stroma cell proliferation should be significantly increased to prepare the implantation, especially for the desvisualization process. However, in the mutant mouse, we can see the opposite direction. We can see abnormal the epithelial cell proliferation and the significant reduction of the stromal proliferation in the mutant mouse. And then we check of course, first step is the steroid hormone signaling, estrogen and progestin signaling. First thing is the ESR1, this estrogen receptor alpha expression level is significant down in the stroma cell. And also the estrogen target gene, including CLCA3, lactoferrin, MOG1 are significantly increase in the GRB2 knockout mouse. How about the progesterone signaling? We also observed the PGR loss in the mutant mouse, as well as several of the progesterone target gene expressions are significantly down, including the IL-13RA2, polystatin, amphilegulin, LRP2 in the mutant mouse compared to the control mouse. So that all of data suggests GRB2 loss resulted in a non-receptive endometrium due to dysregulation of ovarian steroid hormone signaling. So that is the, and then it's GLB2 expressed in the stroma cell as well as epithelial cell. We want to know which compartmental GLB2 functions are critical. So we apply lactoferrin to generate uterine epithelial cell specific GLB2 conditional knockout mouse. You can see the immunofluorescence wild-type mouse show the strong GRB2 expression in the epithelial cell and stroma. In the PL3, all of the GRB2 signaling is gone, but octoferrin-3, we do not see the GRB2 expression in the uterine epithelial cell, but it's still intact to the stromal GRB2 expression. The phenotype study showed this epithelial cell-specific GRB2 knockout mouse have normal fertility. So first, the number of pups are normal, and also the pregnancy date also the normal, and embryo ovulation, fertilizations are normal, uterine histology also normal, as well as in the uterine function, the early pregnancy also show the normal and the decidual response also normal. That suggests endometrial stroma GRB2 functions are critical for early pregnancy. So then we check the more characterization of the endometrial stroma cell in the mutant mouse. First, we examine the stromal cell marker, including COOP-TF2 and bimentin. As you can see, both the stromal marker gene expressions, protein expressions are significantly reduced in the mutant mouse. That suggests in the GRB2 mutant mouse, stroma cells are not functional. So, and that's the downstream of the GRB2 is the MAP kinase ERK. We also want to see what is the effect of the ERK inhibitor. And we also observe the same effect early pregnancy loss. And we want to more deep molecular analysis, so we applied the RNA-seq analysis and first check the quality as we expect. We see the dysregulation of the estrogen and progesterone-related genes. And then we have the GRB2 signaling pathway. As you can see, the expected GRB2-related gene 246 genes are dysregulated in the GRB2 knockout mouse, as well, and also the GRB2 expression are significantly reduced in the mutant mouse. At the pre-implantation stage and post-implantation stage, as well as we can also see the downstream signaling molecule, critical signaling molecule, phospho-ERK1 level also significantly reduced in the mutant mouse. And another interesting finding was the GRB, all of the data suggests stromal GRB2 are critical, but what we observe is the FOXA2 signaling is dysregulated. FOXA2 is only expressed endometrial glandular epithelial cell, not the stroma, but we observed a lot of the around the, and we also compare the transcriptomic data with the previously published one. We identify around 343 genes are commonly dysregulated in the GRB2 knockout and FOXA2 knockout mouse. We are studying more detailed mechanism now in our lab. So, all of data show what we observe is the infertile woman with endometriosis woman. We observe the significant reduction of the GRB2. Using the endometriosis animal model, if we induce endometriosis, it's result to GRB2 loss in the utopic endometrium. And then using the uterine-specific knockout mouse model, we show the GRB2 knockout mouse result in the infertility due to non-receptive endometrium, embryo implantation failure, and decidualization defect. And so the overall data suggests that endometrial GRB2 loss leads to endometriosis-related infertility by causing the endometrial non-receptivity. And another half, I want to share a solution of for the endometriosis-related infertility. We started to apply the nanoparticle to in this field. So first of all, I want to give you some introduction of the STAT3 signaling. STAT3 is a transcription factor. It binds with the PR and several of the cytokine activate STACD, and then it's cytosolic STACD after phosphorylation move to the nucleus and bind to the promoter of the target gene and activate the gene transcription. So the major transcription downstream targets are related angiogenesis, immunosuppression, and inflammation, and chronic pain. All of these downstream targets are very important in cancer biology as well as endometriosis. Also, if after the STACD is activated, it also increases the expression of the several cytokines, including the IL-6. And that trigger more neuroinflammatory chronic pain. So in our lab, around 10 years ago, we identified endometriosis result to abnormal activation of phospho-STACD. We observe the same thing. The phospho-STACD level is significantly increased in the woman with endometriosis compared to control. Using the non-human primate model, monkey model, we also check the phospho-STACD level pre-inoculation and post-inoculation. As you can see, the pre-inoculation the disease before the disease induction, very low level of phospho-STACD, but during the disease progression, we can see significant increase of phospho-STACD. That data is generated from the same monkey and take the utopic and ectopic endometrium from the same mouse. That's possible to check the effect of molecular effect during the disease. But as you know, the human primate model is it take the almost 1 year. Also, the price is very expensive. So if we have the mimic condition in the rodent model, it will be the faster and cost effective. So we applied, check the phospho-STACD level in our rodent model. We observe the same thing, phospho-STACD is significantly increase after endometriosis induction. So the all of data suggests maybe there is a potential therapeutic target for the endometriosis. So there is the FDA-approved STACD inhibitor, topatinib, and it's a selective inhibitor. And also the Hugh Taylor group at the Yale, they applied this topatinib to the mouse endometriosis model. What they observe is volume of ectopic lesions are significantly reduced after topatinib treatment compared to the vehicle. And also the critical factor for the endometriosis-associated pain is tissue adhesion. And they observe the tissue adhesion is significantly reduced after topatinib treatment. And we apply same molecule to our mouse model because we have more sensitive and accurate quantitative study. We observe the same thing. Number of ectopic lesions are significantly reduced after topatinib inhibitor. But in our field, the more difficult thing is several important pathogenic molecules are also play important role in the physiological function. As we also generated STACD knockout mouse in the mouse model, and it's become important. This STACD inhibitor can helpful for the endometrial treatment, but it may impair the uterine function, including fertility. So we checked the implantation, but as we expect, topatinib result implantation failure in mouse. So, and the more detailed the histological analysis show after implantation in the vehicle group, nice implantation and the expression of the several critical molecule critical protein in the implantation site. But in the STAT3 inhibitor treatment case, uterine lumen is not disclosed. Embryo cannot attach. All of the marker gene expressions are abnormal. So the topatinib reduced endometriosis lesion unfortunately impaired, but it's unfortunately impaired the implantation. So because it's the systemic effect. So we think how we can overcome this systemic effect. As you know, now we do not have any biomarker for the endometriosis. So we think about the nanoparticle. Nanoparticle is around 1 to 100 nanometer size of specific molecule. The size is similar to the protein, to the virus, but it's smaller than the cell, but it's bigger than the small molecule. So it's unique. It has a unique functional property, and it's very ideal for the reduce the off-target toxicity. This nanoparticle technology is broadly applied to the cancer biology, but in reproductive biology, it's very limited. So the most important advantage of nanoparticle is we can use the theranostic purpose. That means using the nanoparticle, we can use diagnostic and therapeutic effect. So the basic concept of nanoparticle is in the small molecule, it's during the circulation, due to the size, it can access the all of tissue. But the nanoparticle case, its size is bigger than, smaller than, bigger than the small molecule, but it cannot access to the normal tissue. But in the cancer or endometriosis, they should develop the angiogenesis to survive. During the angiogenesis process, however, they have abnormal angiogenesis. That's what we call the enhanced permeability and retention effect. Simply we call the angiogenetic leakage. So that kind of leakage it make it possible to accumulate to the nanoparticle in the disease area, ectopic region. So that is the structure of our theranostic nanos area. First, the nanos area has the anti-inflammatory factor, which is endometriosis, chronic inflammatory condition. And to increase the size, we use the albumin backbone. Albumin is to minimize the effect of nanoparticles. Some people use several metal or gold, but it can stay in may effect to the bad effect. So that's why we selected the albumin. And the ICG is, as you know, this one is the FDA approved contrast agent. And a lot of the clinic it's already used. So we put the ICG as a contrast reagent. And then using this nanoparticle, and if we apply the photoacoustic image, we can detect this nanoparticle in the live animal model. So that is my collaborator, Dr. Tae-ho Kim at the Michigan State University. He used this arthritis model. First concept is it's anti-inflammatory function. So the phenotype of macrophage. So it's changed from the M1 pro-inflammatory macrophage to the M2 anti-inflammatory macrophage. And that he applied this the arthritic mouse model. You can see the nanocellular application. The level of phosphostasis is significantly reduced, and then it also and also it's switched from the M1 macrophage stage to the M2 macrophage stage. So we apply this nanocellular molecule to our endometriosis preclinical animal model. and then evaluate the effect of nanocelia in the first targeted drug delivery, second non-invasive diagnosis, and therapeutic effect lastly. And that is our experimental design. We treated twice a week for 1 month, and then checked the nanocelia accumulation. It's all of nanocelia accumulator in the liver, and except liver, we only see the accumulation of nanocelia in the ectopic lesion. The good news is it's not accumulated in the uterus and also the other tissue. And then more detailed confirmation using the immunofluorescence, because this nanoparticle conjugated with the ICG. So LED is a signal in the end of the ectopic lesion. You can see the LED ICG signal, but utopic endometrium, we do not observe any fluorescence signal. So that means the nanocelia is accumulated only ectopic lesion in the mouse with the endometriosis. And then we checked this kind of the selective delivery can overcome the side effect of STAT3 inhibitor. We checked the implantation, and then you can see the nanocelia treatment showed the normal implantation. That means it's not damage the uterine function. And from the histological analysis, we can see the normal implantation and normal marker protein expression in the mouse treated with the nanocelia. And then we checked, as you know, there is no non-invasive diagnostic tool for the endometriosis. It can only detected by the MRI or RCT in the big ovarian endometriosis. All of the mouse models are small, the peritoneal endometriosis. And as I already mentioned, this mouse model has the GFP reporter system. We can exactly know how many lesion and where the lesion location. And after we imaging and then we compare with the fluorescence signal, and it's exactly matched. So we can detect the endometriosis using the photoacoustic technique after we injected the nanocelia. And then the most important thing is the therapeutic effect. We can see the number of ectopic lesions are significantly reduced in the mouse treated with the nanocelia compared to the vehicle. So the most important thing is also dose is I think around only we use the 20-fold smaller dose compared to the system because it's accumulated to disease area. So and then lastly, the target of the target molecule phosphoSTAT3 expression is significantly reduced in the treatment group. So the data shows STAT3 activation is a major cause of estrogen-dependent inflammation in endometriosis. And the theranostic, the nanocelia, or novel anti-inflammatory nanoparticle provide a promising approach for endometriosis. So of course, all of data, I think I cannot generate without our lab member. And also the ASCII, Fazilovas, he provided non-human primate model, and Chen provide GLB2 fluxed mice, and Dr. Tae-ho Kim is the chemistry provide all of the nanoparticle molecule. I also have the several clinical collaborator in US and Korea, and also I also need to mention about the NIH grant support. I stop here.